Hi, I'm Dr. Mutuma Njagi. I'm the Public Health Manager at the Village Hope International. On the 14th day of every November, the world commemorates the World Diabetes Day. This is an opportunity for us to reflect on a disease with massive impact to the people worldwide. In this year's theme, we are focused on breaking barriers and bridging gaps towards access of care for people living with diabetes. Today, I invite you to learn with me about this disease. First of all, what is diabetes? Diabetes is a chronic condition in which the body is unable to regulate the sugar levels. It has a significant global burden whereby almost 600 million people worldwide are living with diabetes. 50% of those, their condition is still undiagnosed. In Kenya, almost 2 million people have diabetes, which to translate to 3 in every 100 people. In the 3, 2 of them are living with undiagnosed diabetes. At Village Hope Co, we are focused on building capacity and community involvement as pertains the prevention and management of the disease. We have trained 1,265 community health promoters who have trained over 49,000 households about diabetes. The types of diabetes, there are 4 of them. There is type 1 diabetes, which results from absolute loss or reduced production of insulin, which regulates the sugar levels in the body. Its onset is mainly in the younger populations of below 25 years. Diabetes type 2 is mainly a lifestyle disease with onset mainly at over 45 years. It results due to resistance of insulin produced in the body. Gestational diabetes occurs in pregnant women which results to increased blood sugars. The signs and symptoms of diabetes are not classical. They might depend on whether it's type 1 or type 2 diabetes. These might include increased thirst, increased appetite, and increased urge to pass urine. For those with type 1 diabetes, they might experience weight loss, while those with type 2 diabetes might experience weight gain. Other symptoms include recurrent infection, unexplained fatigue, and bedwetting in children. Complications associated with diabetes are broadly classified into 2. One is the acute, or those occurring over a very short time. These include heart attack, stroke, hypoglycemia, whereby the sugar levels in the body drop down due to either exercise, stress, infection, or wrong dosages. Another significant complication is diabetic coma, which can be associated with either increased or reduced blood sugar levels. This is often fatal. The chronic conditions occur over prolonged duration. These include kidney failure, blindness, sexual dysfunction, and joint damage. Management of diabetes is often multidisciplinary. This means that different groups of health workers are usually involved in management of the same. These might include a diabetologist, a physician, a nurse, a counselor, and a nutritionist. Management might include oral drugs and injectable medications such as insulin. Drug adherence, compliance, and follow-up is very crucial as regards control of normal glucose levels. Nutritionists always recommend healthy diet in terms of prevention and management of diabetes. These include healthy carbohydrates such as whole grain, fiber-rich foods such as fruits, vegetables, legumes, proteins such as chicken and fish, and increased water intake. Physical activity and maintenance of a healthy weight cannot be overemphasized as regards prevention and management of diabetes. In conclusion, it's the responsibility of the households, communities, and governments to advocate for access to care for people living with diabetes. We have a duty to embrace healthy lifestyle habits to prevent diabetes in our communities. Thank you, and see you in the next video.